Hello, so today's routine is going to work on your lower back, your hips and your lower legs. All you're going to need for this is a timer. We're going to start with a classic spine twist. You've probably seen this loads of times before. All you're going to be doing is just laying down onto the floor here. I'll show you a couple of angles so you can see it. And all you're going to do is bring your leg up to there, and holding onto your knee here. Take this arm, bring it out to the side. And then all you're going to do is keep that arm in on the floor, looking towards the opposite hand. Is just gradually bring your leg towards the floor here. It might make you feel quite tight around the back and stuff. You don't want to calm down. Eventually what we want to do is be able to get on the closer to the floor here. So starting out then, if you find that you can't quite take it that far, we use what's called contract and relax. We can breathe in, contract the muscle, and as we breathe out, relax. So we're going to do a minute each side. I'll take you through that. Let me show you this way first of all. So it's going to come to here, down into that position, looking up towards the hand. Breathe in, give the muscles around your glutes, your hips, your lower back a good squeeze. And as you relax off, breathe out. Take the leg a little bit further, okay? Try and do everything, give everything a squeeze. Just take it a little bit further, okay? We're just going to do this for a minute. Like I said, if you feel a bit tight on one side, you want to do a bit of extra time, go for it. Okay, so now we're going to go the other way, so palm up to there, leg up again, hold on to there, this leg stays straight, just lean across there, look into that body, just keep your spine a good twist. Nice big breath in through your nose, squeeze everything in the glute, back, hip. Relax off, bring your leg a little bit lower, okay? Okay, so now we're going to move on to our hips. What we're going to do is starting off now is just placing your feet flat on the floor here. Which you're going to, you want to leave yourself, you don't want to leave your feet too close together. You want to leave enough room so that you're going to drop one leg out and one knee's going to move into that. So you basically want your knee to be able to fit inside your heel here, okay? If you're too close, you'll just sort of land. So what we're going to do, you've got options here. I personally like to just post my arms to give you some balance. Some people do like to come up and not really have anything to post with. I find it best to post with it. It's a good habit to get into anyway. So what we're going to do then, we're going to go either side. I'm going to do 90 seconds here, so about 45 seconds each side. You're going to bring the hips forward there, using your hands to post here, and all you're doing is just leaning forward, closing the gap between your stomach and the inside of your leg here, okay? Come up to the other side, this hand goes over to there, knee down, to there, knee down, okay? And all we're doing, just doing that for a minute and a half, okay? So you're just moving into here, this hip's moving into what's called external rotation, this hip's in internal rotation, you're coming up, switching out the other side, okay? Obviously getting a bit of hip flexion, what's called hip flexion here, that's there as well. Which is really good for grappling and things like that. It'd be really good just for everyday sort of movement, gym movements, like helping you get deeper squat and stuff like that. So it's a good, if you wanted to then you can. I mean you could try it without anything like that. I think personally you just end up kind of fall backwards. So just keep it. Okay. So we just show you for this side angle as well, just to make sure you know you're doing it with your hands. So again, it's here, lean forward here, the hand will come in front of you, you're pushing to there, to there. Okay. In this sort of position, you're going to get what's called an S mount. Your hips are always going to need to be able to flex and rotate. Okay, so 15 seconds now. Just think about rotate, you can see this way. There's actually even little things that you can find where you can actually add things into this as well, which we'll do later on. Okay, that's that done. So now we're going to move on to the lower legs. We're going to start off first of all with your ankles. Now, you don't need a kettlebell for this, but it does enhance the mobilisation if you use one, okay? So, the position that we're looking for then, is just to come into this position here, where you're just sitting kind of on your heel, and the ball of your foot sitting on your heel here, okay? Again, good position to get used to being in. And what we're looking for is just to improve our ability to move our shin closer to our toes, which is called ankle dorsiflexion, okay? A lot of people are quite stiff here. And we want to do that without lifting the heel up, okay? So what we're attempting to do is heel on the floor and drive this forward, move out of the position, drive it forward again. Now, something that makes it easier, if you put a little bit of weight in here, it makes it easier just to sort of drive it forward there, okay? And a little bit more pressure on the joint means you're just going to push through in stiffness, okay? So we're going to go for a minute each side, use the kettlebell or don't, maybe try it without the kettlebell the first time, and then you go into there. And again, if you feel like you're uncomfortable there, you want to sit onto your foot, you can. You might want to adjust all the way through. I've been training today, my knees do feel a little bit puffy, so I probably will just move around a little bit during the session, just for comfort, you know, so I'll just do like 20 seconds there, move back down, because sometimes, you know, just sit on your knees while you're training and then doing this after, sometimes it doesn't feel too good, you know? So just push it into there, really feel like a bit of, sometimes you feel like a bit of blockage in that front joint there, just try and push through that. Okay, so just about 15 seconds there. Okay, so I'll show you from the front now, just so you can make sure you know what direction the knee should be travelling in. So what we're looking for is the foot stays straight, and the knee, without being too picky, it should be going in towards like the middle toes. Now this side here, a bit stiffer for me. That's probably why I don't feel so comfortable just sitting on that back leg. But again, we're doing the same thing. You can even hold it there and just push it through the gap there. You know, attempting to close this space. Like I said, I want my ankle just clicked, and it feels a little bit looser now. I'm not saying that's a normal thing you should expect to happen. You shouldn't be pushing through and feeling clicky. There was definitely something blocking there that I've just pushed through it, and now my ankle actually feels a lot looser before that, so it must have just done a little bit of knotting there or something. So 10 seconds now. Next we're going to continue with the ankles, but we're moving the other way now, and we're going to stretch the muscles down here, down the side of your shin. So for this, this is what we're looking at. This is called plantar flexion, the one was called dorsiflexion, this is plantar flexion, okay? So obviously you've got your shin muscles down here now. It's up to you now. You can either do this one leg at a time, or you can even do it both legs at a time. We'll just start off. What we'll do is we'll do 30 seconds one leg, 30 seconds the other, and then we'll do a minute with both legs, just so you get to see both. You can pick and choose how you like to do it. So what you're going to do first of all is just, you want to make sure that your heel's just on the outside of your butt a little bit here. You sit on there sometimes, it can make it really stiff. So if you come to there, it just gives you a little bit more room to move up, okay? All you're going to do is just place your hand on your knee here. You're going to take your hand, post it one side, and just lift it up, okay? You're going to feel a good pull down through your shin here, and in the front of your ankle joint here, okay? So just into there, you're just going to pull, hold that, and again, you can do like this contract and relax things that we do. So breathing in, contract the muscles through your shin, through your ankle, relax, and just come back, okay? And again, like I said, if you want to just do this a minute each side rather than going both legs, it's up to you. That's there. Again, we're just going to the other side now, just put it up. Again, this one feels a little bit stiffer, but like I said, I just opened up a little bit. It usually starts to feel a bit better. Right there. So again, you don't have to post if you don't feel right not to. So it's good to just don't lose your balance. 10 seconds now. Try to squeeze the shin muscle, relax. One, good. And what we're going to do now then, is just going to go both sides now. So again, what you do is you just double base out behind you here, and you just lean back there, okay? So you see the ankle here, lean behind, just come into there, okay? Again, make sure your feet are not too on top of each other, squash up, just come into there. And again, if you just feel like this is nice, just drop one knee down, grab hold of the knee, come down, grab the knee, just do one side. Just hang out here for a minute or so. Again, you can just contract the muscles there, everything through here, good squeeze, try and lean back a little bit further. This is really going to help, right? Just making sure that your ankles are moving right. That just helps with just ankle function. But injured your ankles, you're not really good like the flippers and stuff. If you know what that is, straight foot locks. it's likely going to be injured if your ankles got moved properly. Really want all the joints to be moving pretty much just how they should really. So that way when you do, if someone does come and grab a submission on you, at least they're not just taking you further than what your body can handle, okay? So that's all done for today. Like I said, if you want to make a slight variation or do one exercise a little bit longer, go for it.